Just to give you guys a little introduction from myself, my name's Ethan Sholem, and I want to thank ICG. Thank you, Ira, for the nice introduction. This webinar is going to be great for people on Medicare because the annual enrollment period is approaching. It's always good to understand your current plan better and other options that you may have. And it's great for people who are not on Medicare, so you understand your timing and then, of course, all your options as well.
Hi, I'm Jamie Sholem. I am the president and founder of Senior Star. I want to thank you, Ira, for that wonderful introduction. I also want to thank ICG, Deb, everybody, the whole team there for having us. Um, Senior Star's mission is to educate our clients and provide them access to all of the options that they would find that it's available to them in Medicare. And that's what we do. We do conduct these workshops, webinars, these educational seminars every single month. And we're delighted to be here with you. And just, thanks again. Now, next. So, whether you're turning 65 or whether you're already on Medicare for years, there's a lot of misinformation that floats out there about Medicare. Some of it's accurate, but limited. Some of it's not accurate. We're just going to discuss the facts tonight. We're going to tell you about Medicare, inform you, and arm you with the information that you need to make the best decisions for you. We're not going to come in with any bias. We're not suggesting any plans or any type of plan. We're going to go over some terms that we're going to use tonight. Premium. A premium is simply the monthly amount that you're going to pay to be in that plan. A deductible is an amount that you have to pay out of pocket before that plan actually starts to cover you. A copayment is a set dollar amount. It's your co-share for that visit at the doctor's office or procedure. Co-insurance is also your co-share, but it's a percentage of the cost of the procedure. So it might be 40% rather than $30. And finally, this maximum out of pocket, many of you probably have that in your plans that you have now, is a threshold where if you've spent that much money out of pocket for co-pays, co-insurance, or any other expenses in your Medicare plan, in your medical plan, then when you reach that threshold, they will cover you at 100% for the rest of the year. It is not a deductible. It's kind of the opposite of a deductible. You're not required to spend that much, but if you do, you're protected after that. What are we going to cover today? Well, we're going to cover the different parts of Medicare, the A's, the B's, and the C's, all those letters that are floating out there. We'll clear that up today. We're going to cover the expenses in Medicare. Original Medicare isn't free. And we're going to talk about the deductibles, the premiums, and what you would be exposed to in Medicare. How and when to enroll. What are your deadlines? What happens if you don't enroll? Well, one of the things that's going to happen if you don't enroll in time is you're going to get hit with late enrollment penalties. There's a lot of stuff out there about the penalties. We're going to tell you exactly what they are and when they apply. What are the two main pathways that people choose when they go on Medicare? Well, there are two main pathways. One is to have a Medigap plan. It's also called a Medicare supplement plan. That's one way. And the other is a Medicare Advantage plan. They also call that Part C of Medicare. So there are a lot of interchangeable terms, but we're going to compare the two, show you what the differences are, and we're going to explain that. We are going to give a minute or two to why it makes sense for most people to use an independent agent. We are independent agents. We believe in our service, and we're going to tell you why. And then finally, next steps, whether you're in Medicare now and looking to make a change, we're right upon the annual enrollment season. Whether you're coming in Medicare and you want to know whether you have to go on and you're ready to do it now or maybe perhaps later, what can you do to keep yourself informed? By virtue of the fact that you're here tonight, you're educating yourself. It's a good first step. So, what can we do to keep you in that vein?
All right, everybody. So now we are going to get into the parts of Medicare, starting with Part A, also known as hospital. Part A, hospital insurance. Now, it's not just hospital insurance, it's anytime you are inpatient. So that could be skilled nursing care as well. Anytime you're staying somewhere overnight, Part A will be the insurance. Now, the other part of Medicare, of original Medicare, is Part B, also known as medical, Part B medical insurance. This is everything else that you do in Medicare. Anything outpatient, where you're in and out the same day. Doctor office visits, MRIs, tests, treatments, lab work, physical therapy, even same day surgery. So that's Part B of Medicare. That's outpatient care. These two parts of Medicare are known as original Medicare. It's the only thing that actually is Medicare from the government that doesn't get help from a private insurance company. It's the foundation of everything else that you're going to do in Medicare. Original Medicare is Part A and Part B. Now, it doesn't cover you for everything. On the outpatient side of things, it's about an 80% coverage, so you would owe 20%. For the Part A hospital insurance, it's not quite an 80-20 split. There are deductibles, sometimes daily deductibles. We're going to go over that in the next slide, but you can look at it basically like original Medicare leaves you exposed to 20% of all of your costs. It also doesn't cover your prescription drugs. So we can get you a prescription drug plan in two different ways, and we're going to go over that. That is known as Part D of Medicare. And then out of order on purpose is Part C. It's out of order because Part C is not really a part of Medicare. It actually takes over for Medicare in the form of a private insurance company. It's also known as a Medicare Advantage plan. We've all seen advertisements and commercials about that. So, the Medicare Advantage plan, also known as Part C, it combines the other parts of Medicare, A, B, and D, into one plan, again, facilitated by a private insurance company. So this slide is the costs in Part A if you didn't have any help from a secondary company. Okay. So we're going to scare you here a little bit on this slide. There are solutions, but we just want to know what we just want to tell you what you are exposed to. On a monthly basis, Part A for most Americans is $0. If you or your spouse worked 10 years or more in America paying taxes, then you don't have a premium for Part A, which is obviously fantastic. Now, let's say you actually need to use the insurance. You get admitted into the hospital. Whether you're there for one night or 60 nights, you're going to have a one-time deductible of $1,676. Excuse me. So that's not too bad if you're there for 60 nights. It's not great if you're there for one night, but it's a one-time deductible. Let's say you're there for over 60 nights, 60 days. Well, now you have a daily deductible of $419. And then if you're there for 90 days or more, that daily deductible doubles. So now you're paying $838 a day. And you start to chip away at 60 lifetime reserve days that you have in the hospital. So if you're there 100 days, let's say, well, you paid the $1,600, you're paying daily deductibles all the way from day 60 to 100, and now you only have 50 lifetime reserve days left. Okay? So on the skilled nursing side of things, that's still in Part A. They cover you, original Medicare Part A covers you for the first 20 days in full. But there's no magic fairy dust that says you're only going to be there for less than 3 weeks. If you're there from day 21 to 100, you will have a daily deductible of $209.50. After day 100, it's all on you. So you're pretty exposed in Part A if you didn't have any secondary coverage or help. Part B, this is, remember, outpatient. So anything you do where you're in and out the same day, you do have a monthly premium. Now in 2025, the monthly premium is $185 for most Americans. That's the standard premium. That will go up in 2026. We don't know what that premium is yet. So it's $185 for most Americans. That can be $0 if you have Medicaid in addition to Medicare, but it also can be a lot more than $185 if you are a high income earner. We'll go over what those tax brackets are and what the government considers a high income earner, but most Americans pay 185, and that's the figure that we're going to use for the sake of this presentation. Okay, now you got to use the insurance. Well, you'll have a yearly deductible this year of $257. Not too bad. So you pay that in January or February. And then what? You get to pay 20% for everything else that you do. There's no ceiling either. There's no maximum out of pocket in original Medicare. So if you have $100,000 worth of bills, guess what? You're paying $20,000 that year. So Part A leaves you exposed, but so does Part B.
Okay, now that you're good and scared, what do people do about those costs in original Medicare? Well, there are two main pathways, and I've coined the term the government pathway for the first one. It's my term, it's not official. The reason I say it's the government pathway is because you're going to allow your original Medicare card with Parts A and B on it to lead the way. It's going to be your primary insurance, it's going to pay first, and then you fill in the gaps. And the first way you can get your Part D of Medicare, your drug plan, is to add a standalone drug plan to this formula. And it's going to be based on your drugs. Right now in New Jersey, there are 14 separate standalone plans. You pick the best one that has the least cost for you and your medicines. And then you're going to add a secondary health plan called a Medigap plan or supplement plan that does exactly that. It's going to take those costs that Ethan just described in original Medicare, both on your inpatient basis and on your outpatient basis, and it's going to pay those. So it sounds a little complicated and it sounds expensive. You're going to have three separate cards. You're going to have three separate monthly premiums. Why does anybody want to do it? Two main reasons. First, if you have original Medicare as your primary insurance, that opens the door to every Medicare provider in the country, not just in the region, in the country. So you have absolute freedom to choose your provider. You are no longer in a network. The other reason people choose this path is that even though there's a monthly premium for the Medicare supplement policy, there's no other risk, there's no other exposure. You are covered. Medicare takes the 80%, the Medigap plan takes the other 20%, give or take some small nuances, which we'll go over later, but you have stability of cost, knowing what you're going to be paying for your health insurance that year, and you have the freedom to choose any provider you want. That's perfect for a lot of people. They can sleep well at night in that scenario. Doesn't cover extra benefits, it doesn't cover dental, but on a medical insurance basis, it's perfect. Let's switch gears. Let's talk about the other way to be in Medicare, Part C. I call it the private path. Why? Because it rolls the benefits of Part A and B into it, and it includes some of the others, which I'll describe. These are facilitated by private companies. They are managed care plans, which means there is a provider network that you have to pay attention to. You're no longer on original Medicare, though. You can actually leave that Medicare card at home. You don't need to bring it to the doctor, but you still have to have it. You have to have Part A and B. You have to pay your premium for whatever that's going to be for Part B, most likely 185. In these plans, embedded in these plans, are going to be the drug coverage. You will not have a separate card for the drugs. You will not have a separate premium for the drug coverage. They also include other benefits that are not going to be in the first pathway, in the government path, things like dental insurance, vision insurance. They give you hearing aids. They give you over-the-counter items that you can get for free. They actually give you like a gift card in some of these plans, and you can get vitamins and you can get Advil and things like that for a certain amount every 3 months. But be mindful, there is a provider network in the plans that allow you to go out of network. If you do, you're going to pay more and have limited coverage. And you will pay copays as you go along. You may have a specialist copay. You may have a copay for an MRI, for a hospital stay, and so forth. Here's the other attractive thing about these plans, though. Many of them have either very low or no monthly premium to be in them. And that works out for a lot of people. When you compare these plans to some of the group plans people are coming out of, sometimes these plans compare favorably.
All right. So now we are going to talk about when to get Medicare. We're going to dive into both of those two pathways that my dad just explained in a lot more detail, but we're going to talk about when you can get into Medicare for a few slides here. So Your first opportunity to get into Medicare is known as your initial enrollment period, and it's a 7 month window that surrounds your 65th birthday. It's it starts 3 months before the month of your birthday. It includes your birth month and it extends to 3 months after. It's very important to pay attention to Medicare during this time frame because you don't want to get into trouble with the government. You don't want to make the wrong decision. So this 7 month window is your initial enrollment period when you can first apply for Medicare, and you should definitely pay attention during this window so you understand your options with timing and with your coverage. So, what's the big question that probably a lot of people on this webinar have, and a lot of people that we talk to has? Do you have to get on Medicare when you turn 65? And the answer is maybe. I'll explain that. If you are on a plan that is deemed creditable, it's creditable, then you don't have to get on Medicare when you turn 65. What is a creditable plan? Well, first, it has to have 20 or more people on it. So if you work for a small law firm or a small doctor's office and there's not 20 people, it's not creditable. And then the second box that needs to be checked off is that it meets the coverage requirements that Medicare sets out. It has to have at least the coverage that Medicare gives you. So if both of these boxes are checked and you have a creditable plan, you can wait until you lose that plan to get on Medicare. If it's not creditable, you will have to get onto Medicare in your initial enrollment period, that 7 month window, to avoid late enrollment penalties. Let's say you have a creditable plan. Well, what are your options? You have a special enrollment period. You have 8 months after you lose that creditable plan to get onto Part B of Medicare. However, you only have 63 days to get onto Part D, the drug portion of Medicare. So you can look at it like you have a 2 month window after you lose that creditable plan, whether through retirement or maybe you get fired or whatever the situation, to get on to Medicare. Obviously, you're not going to want to be without coverage for 2 months. You probably don't want to pay for Cobra either. You can obviously time up your Medicare to take effect when you lose that creditable insurance. You don't have to wait the 2 months, but frame it in your mind that you have a 2 month window to avoid any repercussions. What are the repercussions? What are these late enrollment penalties? Well, you can get hit in two parts of Medicare. There's a penalty for Part B and for Part D. So, for Part B, for every 12-month window that you've not been on it, that you should have been, you will be charged a 10% penalty that's based on the standard monthly premium. Again, in 2025, that's $185. So if you haven't been on Part B for 2 years when you should have been, that's a 20% penalty, which is 37 extra dollars a month. For Part D, they'll hit you a little different. It's a 1% penalty for every single month you have not been on Part D when you should have been. They base this percentage on a standard premium the federal government comes out with for drug plans, which is $36.78. That's not what your drug plan is going to cost, but they need a figure to base the percentage off of. So you're not been on Part D for 2 years, you should have been. 24% penalty, which is an extra $8.83. Two things. The standard premium goes up every year, which means that the dollar amount of that percentage is going to go up. And the late enrollment penalty never goes away. It's every single month for the rest of your time on Medicare, which is probably for the rest of your life. So that's why I said earlier, pay attention in your initial enrollment period because you at least want to check in with your HR department that your plan is creditable so you could avoid these late enrollment penalties. Now, Cobra is not creditable. Obamacare, also known as Get Covered New Jersey or ACA or something else in other states, is not creditable. And some employer plans are not creditable. So, again, reach out to HR or your benefits administrator and ask them for a letter of creditability just for your own peace of mind. Now, Is the first election that you have in Medicare permanent? No. There obviously can be some implications later on, but it's not permanent. We are approaching the annual enrollment period right now. We're super busy. We're starting to talk to our clients. It is October 15th to December 7th every single year. And this is when you can make a lot of changes in Medicare. Let's say you're on a Medicare Advantage plan, that Part C. You can do a lot of things. You can stay on that plan. You can switch from one Advantage plan to another Advantage plan. You can actually drop that Advantage plan, pick up a prescription drug plan, and go back to original Medicare. If you're on original Medicare and you have a standalone drug plan, you can switch those. Let's say you got a new medication in the middle of the year and the drug plan that you're on in 2025 is not giving you a fair copay at the pharmacy, or maybe it doesn't even cover that medication. You're going to want to switch your drug plan. And you can also switch Medicare supplement plans. However, you will be asked to answer health questions to switch from one Medicare supplement plan from one company to another, or maybe from one plan within the same company to another. Every Anytime you want to switch outside of your initial enrollment period and your special enrollment period. So again, you can get into a Medicare supplement plan. That's the plan that works with original Medicare with no health questions in your initial enrollment period or your special enrollment period. Anytime after that, they will go through a medical underwriting process. It's not crazy. It's like a questionnaire and they want to know your medications a lot of the time, but they can deny you coverage or they can raise your premium to a ridiculous number. And that's why it's really important to know this when you're making your first election. Because if you want a supplement plan, you might want to do it now rather than later, given the fact that if your health declines, you may not be able to get in. We're going to talk about these supplement plans in more detail now, okay? Just like the parts of Medicare, the Medigap plans are also identified by letters, just they want to confuse us more. But the good news is the Medigap plans are the popular ones are different letters. It's Plan G and Plan N. Now, an important thing to note is that Plan G and Plan N, all Medigap plans, are standardized, meaning a Plan G with one company is the same exact Plan G with another. You can go to the same doctors and the coverage is exactly the same no matter the logo on your Medigap card. So there's 24 different companies here in New Jersey that offer the same exact federally standardized Medigap plans. 24 different companies, same plan. How do you know which one's right for you? Well, you want to make sure first that they're going to charge you a premium that's not ridiculous. They will charge you different premiums depending on the company you go with, even though the plan is the same. So you want to make sure your starting rate is not ridiculous. You want to make sure that the company that you're going to purchase a plan from is financially stable. And you also want to make sure that they're treating their current beneficiaries fairly. In simple terms, they're going to raise your rate every year and you don't want to get ripped off. Okay. A little bit more about these plans. Medicare supplement, also known as Medigap, works with original Medicare. The A and B card leads the way, and that secondary plan comes there and it pays some of, if not all of the deductibles, copays, and coinsurances that original Medicare doesn't cover. You're gonna pay an additional premium on top of that 185. So you're gonna pay a private company an additional premium for this plan. And there's no networks. A and B leads the way. 97% of providers in the country take Medicare. So you're going to be able to pretty much go wherever you want. I mentioned this a few times. I just want to say it one more time. Plans are standardized. If you've received rate increases throughout the years, it's important to see if you could save money because you're going to want to switch while you're healthy because when you're unhealthy, you're going to be stuck in that plan. So as your rates go up, let's say you're in plan G or N, well, you might as well shop around. The insurance is the same and you can go to the same doctors. The There's no maintenance in these plans. You don't have to re-enroll. and they're not going to increase your rate due to your personal health, which is nice. And there are no pre-authorizations or referrals. I'm going to keep this short because due to the big, beautiful bill, there are some changes to this pre-authorizations and referrals uh, bullet point here. There's a pilot program where in 6 states there will be some pre-authorizations and referrals. New Jersey is one of those states. It's on 17 different types of treatments, but the big picture is that there is not going to be a high frequency of pre-authorizations in a Medicare supplement plan. If the original Medicare pays for it, then the Medigap plan will as well. There's no claims committee with these guys. This is the outline of coverage we're taking a look at here. So let's look at Plan G first. Let's say you're admitted into the hospital. Well, that deductible, remember from day 1 to 60 of $1,600 goes away. Those daily deductibles, if you're there from day 60 to 90, goes away. And you also get an additional 365 lifetime reserve days. Original Medicare gives you that 60. A Medigap plan gives you an additional 365. Let's say that you're in the hospital, you get discharged to a skilled nursing facility. Well, you get the full 100 days covered with a Medigap plan. $0 if you're in a skilled nursing facility for 100 days. That's part A. Now, on part B, you will have to pay the deductible. This year, it's $257. So you pay the part B deductible, you have a plan G, and guess what? You're done. Doesn't matter how many times you go to the doctor. It doesn't matter if you're going to physical therapy or you get a stress test or an MRI or an outpatient surgery. You won't have any copays for the rest of the year. You pay that deductible and then you're done. Now, Plan N is a little bit different. It's a great plan. Part A is the same. You go to the hospital, you're probably not going to see a bill ever again. You get 100 days skilled nursing. Now, it differs in 3 different ways on the Part B, the outpatient side of Medicare. You still have to pay that deductible of 257, but you will have $20 copays after that at doctor visits. Not an MRI, not a test, but a visit or a follow-up. The copay will be up to $20, not more. There's a $50 copay in the emergency room, and it doesn't cover an extremely rare fee called an excess charge. Those are the 3 differences. Plan G covers more technically, so it's a higher premium by about 40 to 50 bucks, but Plan G is more popular as well.
All right, let's take a deep breath. We're about to switch gears. We're going to be talking about the other pathway, the private pathway of being in Medicare. So remember, this takes over for original Medicare. In New Jersey this year, there are 10 different companies that are offering 41 different plans in these Medicare Advantage private plans. They all have different networks. Even some of the same companies that have multiple plans, the networks aren't all identical sometimes. They all have different copays, different benefit levels, different over-the-counter amounts, etc. So the point of this slide is to tell you that there are basically 41 unique plans in New Jersey this year in these Advantage private plans. So again, just to go over this in a little bit more detail, these take over for original Medicare. These are managed care plans with provider networks. So the benefits of Medicare are rolled into this one plan. You still need to have your original Medicare in place. You still need to have parts A and B and paying whatever your Part B premium is. Again, it takes over for original Medicare. You will have a network to abide by. They do have what's called a PPO in some of these plans where you can go out of network. If you do, you will be paying more of a co-share. They're making that more difficult as time goes on because PPOs cost these insurance companies more money. So they're going to transfer that charge to you. I want you to think about being in these plans as staying in the network. Be ready to go to the providers that are in this network. It's going to include a lot of extra benefits, including your drug coverage. Other things like dental and vision and over-the-counter benefits, those things have value and they have meaning. Finally, a lot of these plans are going to be very low or zero additional monthly premium just to be in the plans. So, what do some of the costs look like? What do some of the copays look like in these Medicare Advantage plans? Well, in New Jersey right now, it's likely right now to have a $0 premium. And there are many choices that are still currently out there where you can be in that company and in that plan for nothing per month. The maximum out of pocket, well, that can go up to $9,350. Remember, that's your protection. That's if you get sick and you're using this plan and you go into the hospital and maybe you have chemotherapy and etc. Well, they'll cap your spending at this maximum out of pocket level. Well, to be honest with you, most of our clients are in a plan that's going to be around $8,000 before you hit that maximum out of pocket. If you go out of network in the plans that allow you to, that can go up to $14,000. Hospital stays, they charge you a per day rate for a certain set number of days. An average 10-day hospital stay in New Jersey is going to be somewhere around $2,000. You can see it can go up than that. It can go up higher than that, almost $2,400 in network, or it can even be a co-share of 40%. So be careful with that. Doctor visits, your primary should be zero. Your specialist can be anywhere from $10 to $50 to a co-share as well. Labs, diagnostics, x-rays, outpatient surgeries, all of that can vary tremendously from plan to plan. So if you like the concept of these plans, you like that there's no premium, how do you choose one? Well, this is how we help people choose one. We take them through these steps. First of all, we want to look at your drugs. We want to look at your meds first because you might be in a plan that looks really great. It's got all the bells and whistles, but if your drugs are going to cost $1,000 more in the plan that year, it takes that value right away. So you want to make sure that your plans are covered, and then you're going to compare those costs of your drugs to other plans. The same drugs don't cost the same thing from plan to plan. So be mindful of that. Then we're going to look at your physicians and your providers, and we want to make sure that they're either in the network that you're going, or if they're not, you're aware of it, and what do you have to do in order to either replace that provider or to still go to that provider, and what your costs would be. But you get the lay of the land, you figure that out. You want to know that any facilities, hospitals that they're associated with or that you want access to are going to be in network. Again, if it's not, you need to know what that means for you. Then you want to compare copays, co-insurance, copays, charges. And then finally, you're going to look at the bells and the whistles and the dental and the over the counter and how many free rides you get to the doctor and so on. It's really the last thing you want to look at. It's the first thing that the marketing and the advertising leads with. They almost make it sound like you can peel away that extra benefit and not have the plan. Not the case. The extra benefits are the last thing you want to look at. Now, we help our clients step by step do this. I recommend that you do it for yourself, or you do it with another agent, or you do it with us. But this is the steps that we recommend in searching these plans. When you do it this way, you fine tune your search, and then you get to a place where you feel comfortable.
All right, so we're going to go over what it actually looks like on a hard monthly basis for you to be in either one of these pathways. Now, the first two line items are the same across the board. Part A should be $0 as long as you or your spouse have paid taxes for 10 years or more. Part B, remember the standard premium is 185. So, we're looking at Plan G here, not as a universal recommendation, but because it is the most popular. They will rate you based on your age and gender for a Medigap plan. Females are a little bit less expensive. So if you're 65 years old and you're looking to get a Plan G, you can get that for about 148 bucks here in New Jersey. There's a few companies where you can get it for less than that. There's a whole lot of companies where you can get it for more than that. If you're a male, you can get in around 170. Again, you could pay less a little bit, but you could definitely pay more. Okay. Now, for your standalone drug plan, what are we looking at? right here, we have $18 as a monthly premium. That is maybe what your drug plan is going to be. It may not be. I can't tell you until I have a list of your medications, but you can get into a drug plan lower than $3 a month. You can get into a drug plan over $100 a month. We're assuming for this presentation, it's $18. So you could be all in as a female with a plan G for $351 or a male for $373. What are your variables? Well, your prescription drugs. If you get a new medication in the middle of the year, you can't change that drug plan until the annual enrollment period. So you might have to eat that cost until you can get into a new drug plan. But you're not going to have variables when you actually go to the doctor or the hospital. Now, in the green is the Medicare Advantage. Again, $0 for A, 185 for B. And that's it on a monthly basis. But what are your variables? Everything you do. Are you going to use the plan? Are you going to go to the specialist? Well, there's $30. Are you going to need a cataract surgery? There's $400. Did you have to go to the hospital for 5 days? Well, that might be $2,000. So and your drugs. Your drugs are also variables because they are wrapped into this plan. So you are exposed to more, but you're paying less on a monthly basis when you're looking at an Advantage plan. All right, so this is the high income earner tax bracket chart. It is known as an IRMA surcharge, and IRMA stands for Income Related Monthly Adjustment Amount. They're taking a look at your modified adjusted gross income from 2 years ago. They're always taking a look at 2 years prior. So this year, they're taking a look at 2023. Next year, they're looking at 2024. If you are a couple, you file your taxes together, you made over $212,000. If you're there between 212 and 266, your Part B premium will be $259. And they're going to hit you on Part D as well with an additional $13.70. If you file your taxes as an individual and you made over 106,000, you're going to get a surcharge. The more you make, the more they take, obviously. Now, you can appeal this. There's a lot of reasons why people made less money this year than 2 years ago. If you have questions about that, you guys can let us know. There's many reasons why you might have made less this year.
Okay, we're going to spend a minute on the use of independent agents, and I say independent because as opposed to captive, if you're working with an agent that works for United Healthcare or Humana, they might be able to sell you the best Humana plan, may not be the best plan for you in the market. Independent agents like us have contracts with multiple carriers in both pathways. So what we do is we help our clients just go window shopping. It makes no difference to us what the logo looks like on the card that you choose, on the plan that you choose. And you want somebody that's going to have your best interest. We do not care what company you go in. We don't even really care what kind of plan you go in, as long as it's the plan that you think is best for you. We educate you. We take the time to find out what your needs are. We help guide you, but it's your decision in the end. An independent agent can do that for you. We don't charge you, by the way. We get compensated by the insurance companies. A little secret I want to tell you is that the compensation for a Medicare Advantage plan, especially in New Jersey and in California, where the comp is highest in the nation, a Medicare Advantage plan commissions sometimes more than double a Medicare supplement plan. And I tell you that only to let you know that for one, our practice is still a little bit higher in terms of the supplement plans because we don't care. We're not looking to make more money in one transaction. We want to build trust. We want to build, favor. We want to earn your business and have a long-term relationship with you. So it's important that if you use Senior Star Insurance Group or any other agency, that it's an independent agent that you can trust and that can put you where you belong. So you have that help even after you enroll, customer service, questions. That's it.
So this is we're wrapping up here, guys. If you're ready for Medicare and you're turning 65, if you're already collecting Social Security, they're going to send you your card in the mail automatically. You don't have to apply. So look out for that card about 3 months before you turn 65. Again, if you're collecting Social Security. If you're not collecting Social Security, there's three ways to apply. You can go online. That's the easiest. If you want to torture yourself, call the 800 number, and you can try to get an appointment in person as well. That's not always very easy. Sometimes they schedule 3 months out and so on. But online at ssa.gov is the easiest. We could send you like a step by step on how to do it as well. All right, guys. So that's pretty much it. What happens next? Well, we don't have a request for information. That's for our in-person workshops. If you guys want to get on our monthly newsletter, we are happy to get you onto that. It just gives you some updates on Medicare. There's a puzzle in there. There's a recipe. It just lets you know you got a Medicare guy if you need it. And this is us. So, thank you guys for hanging in there. I know there's a ton of information. And again, thank you, ICG, for allowing us to present.